I'm Dr. Ali. Welcome back. For those of you who are joining us for the first time, I'm a functional physician, and my goal is to provide education and guidance to our patients, their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. Today, we will be talking about fatty liver and the root causes of fatty liver. So let's start off by talking about what is fatty liver disease. So non-alcoholic fatty liver disease is the term given to a range of conditions that cause a buildup of fat in the liver. This is usually seen in people who are overweight or obese, but it is not necessary for someone to be obese for them to get fatty liver. Fatty liver is becoming increasingly common, with 1 in 4 people having fatty liver disease. There are 4 stages of fatty liver disease. In the first stage of fatty liver disease, which is called simple fatty liver, a largely harmless buildup of fat in the liver cells is noticed. That is often diagnosed when certain tests are carried out. The second stage is called NASH, or non-alcoholic steatohepatitis. This is a more serious form of fatty liver in which the liver becomes inflamed. The third stage of the disease is when there is the process of fibrosis. What that means is that when there is persistent inflammation, that inflammation causes scar tissue around the liver and nearby blood vessels. This is affecting the liver's ability to function. However, the function of the liver is not completely compromised. In the fourth stage of the disease, which is called cirrhosis, after years of inflammation and fibrosis, the liver shrinks in size, becomes scarred and lumpy. This is permanent damage and it leads to liver failure. Liver is a very important organ in the body. It performs a lot of different functions, and we cannot survive without a functioning liver. Hence, fatty liver is a life-threatening condition which is linked to a lot of other diseases, such as diabetes, high cholesterol, heart disease, and stroke. The question is that, are you at risk of fatty liver disease? Those who are at increased risk of fatty liver disease are, number 1, who are obese or overweight. It is also important to know that those who are obese and have fatty liver disease will have a very difficult time losing weight. Number 2, anyone who has type 2 diabetes is at risk of fatty liver disease. Those who have insulin resistance also have a high risk of fatty liver disease. These individuals also are at risk of polycystic ovary syndrome and hormonal disturbances. Another category are those who have an underactive thyroid. These individuals are also at risk of fatty liver disease. Those who have high blood pressure, high cholesterol, as well as metabolic syndrome are also at risk for fatty liver disease. Those who smoke and are over the age of 50 are also at risk of fatty liver disease. It is important to note that fatty liver has also been diagnosed in people without any of these risk factors, and it has also been diagnosed in young children. Usually in the early stages of fatty liver disease, there are no symptoms, which is one of the reasons why it often is not diagnosed early on and often missed. Occasionally, people with fatty liver disease, usually in the stage of fibrosis or cirrhosis, may experience symptoms. One of the symptoms is dull or aching pain in the top right abdomen. These individuals can also have fatigue as well as unexplained weight loss and weakness. Later on, as the liver starts to fail, a lot of other symptoms come into the picture, such as jaundice, as well as issues with the functioning of the brain. How do we diagnose fatty liver disease? Usually, fatty liver disease is diagnosed when the blood work shows that the patient has abnormal liver function test. However, it is also diagnosed at times when an ultrasound of the abdomen is done, which shows that the liver contains a lot of fat. What is the treatment for fatty liver disease? In conventional medicine, there is no treatment for fatty liver disease. The only recommendation for these individuals is to lose weight. Unfortunately, these individuals have a very hard time losing weight simply because they actually have fatty liver disease, and liver plays a very important role in helping with weight loss. However, in functional medicine, we are able to reverse fatty liver disease by identifying and addressing the root cause of the problem. So let's talk about what are the root causes of fatty liver disease. One of the most important root cause of fatty liver disease is dysbiosis. So let's talk about dysbiosis. Dysbiosis is a term which means that there is imbalance of bacteria in the digestive tract. This imbalance could either be because there are too many bad bacteria and or yeast or fungus, or it could be that there is not enough of good bacteria in the digestive tract. We know that when there is bad bacteria and or fungus, these bacteria can trigger inflammation. That inflammation contributes to the accumulation of fat in the liver and then leads to liver damage. The second important cause of fatty liver is high cortisol. Cortisol is a hormone produced by the adrenal glands. These glands are present on top of our kidneys. This hormone is released in response to stress. The stress can be external stress or it could be internal stress. We know that cortisol contributes to the development of fatty liver disease. Cortisol is also released as a result of inflammation. And so inflammation can also cause fatty liver disease. Cortisol increases the production of glucose in the liver. This leads to high blood sugar levels, and that also contributes to accumulation of fat in the liver. In addition, cortisol has been linked to other risk factors for fatty liver disease, such as insulin resistance. Chronic stress can lead to elevated levels of cortisol, and this has also been linked to an increased risk of fatty liver disease. The third and important cause of fatty liver disease is toxins. We know that exposure to toxins leads to development and progression of fatty liver disease. As we know that liver is the organ for detoxification, some of the toxins can damage liver cells and impair the liver's ability to metabolize and eliminate fats from the body. Specific toxins that have been linked to fatty liver disease include fructose and chemicals such as bisphenol A or BPA, phthalates, and POPs, or persistent organic pollutants. Some of these toxins are present inside our homes, and others are part of our environment. Last but not least, an important cause of fatty liver disease is nutritional deficiencies, specifically deficiencies in vitamin D, vitamin E, and omega-3 fatty acids have been associated with an increased risk of fatty liver disease. Vitamin D deficiency in particular has been linked to the development of fatty liver disease because vitamin D is involved in regulating the metabolism of fats in the liver. And low levels of vitamin D has been associated with increased fat accumulation and inflammation in the liver. A deficiency of vitamin E also contributes to fatty liver disease because it impairs the liver's ability to protect itself against oxidative stress. Oxidative stress is produced as a result of inflammation, and it can damage liver cells and promote the development of inflammation. Omega-3 fatty acids found in fish, nuts, and seeds have anti-inflammatory properties that can help reduce inflammation in the liver and protect against the development of fatty liver disease. If you have fatty liver disease or you have risk factors which put you at risk for fatty liver disease, it is important that we look at the root causes and we reverse the problem before it moves on to full cirrhosis and liver failure. Thank you so much, and we hope to return with more information on other important health topics.